People may be able to fly after a stroke if a doctor believes their health is stable. However, they may need to take precautions, such as allowing extra time, keeping medication accessible, and traveling with a companion. A stroke occurs when something blocks blood flow to a region of the brain or when sudden bleeding occurs in the brain. People who have a stroke may be at increased risk of another. Recovery will differ for each individual and may depend on the severity and type of stroke. After recovery, some people may be able to fly safely. However, they may benefit from extra precautions to prevent further health risks, such as a blood clot in the leg, dizziness, heart attack, or another stroke. Can someone fly after having a stroke? Please subscribe. Whether it is safe for a person to fly after a recovery and current health. Flying after stroke may depend on there may be safe if the person's health is stable. However, air travel can pose some risks to those with cardiovascular problems, such as potentially increasing blood pressure, so taking precautions to counter these risks is important. Airlines can refuse anyone with a medical condition that could cause severe issues on a flight. People may need to provide medical clearance from a doctor to say they are safe to fly. Individuals need to use their airline's website or helplines to check their policies around flying and health conditions. Tips for flying after a stroke. Flying after a stroke is a common concern for stroke survivors. It is important to consult a doctor before flying, as they can determine if you are medically stable enough to fly. Here are some tips to make your journey as stress-free as possible. Contact the airline in advance. Get in touch with the airline at least 72 hours before your flight to arrange any special assistance you may need. This can include wheelchair services, vision or hearing assistance, and device transport. Airports also have assistance points where you can request transportation help to navigate the airport if your mobility is limited. Travel with a companion. If possible, travel with another person for extra support. Tell them about your medical history, requirements, and how to respond in an emergency. This can give you peace of mind, especially if it is your first time flying after a stroke. Get travel insurance. Protect your trip by purchasing travel insurance. This can help refunds or rescheduling flights. Additionally, medical care with abroad can be costly, so ensure you understand your health coverage at your destination. Allow extra time. Give yourself plenty of time to get through security and walk to your gate. This will help reduce stress or anxiety if you need more time due to movement or cognitive function issues. Keep medication in your carry-on luggage. Easily access your medication during the flight by keeping it in your hand luggage. Ensure you have enough medication for your entire trip. Also, keep medication in all sets of luggage in case any baggage is lost. Carry medical documentation and declare medication. Some countries may confiscate medication that hasn't been declared, so be sure to know your destination's requirements. Carry medical documentation with you at all times. Wear compression socks. Compression socks improve circulation in your legs and prevent blood clots from forming. Choose knee-high socks with 20-30 mmHg compression for the best results. Stay hydrated and avoid salty snacks. Drink plenty of fluids and avoid caffeine, alcohol, and salty or fried foods. Staying hydrated will help you feel better and avoid elevated blood pressure. Move around regularly. Get up and walk around the cabin when it is safe to do so. If you cannot walk, perform leg exercises while seated, such as marching in place or pumping your ankles. Movement helps prevent blood clotting. Be mindful of what you eat and drink since this can have a direct effect on blood pressure, an important stroke risk factor. Staying hydrated and avoiding excessive salty snacks can help you feel better and avoid elevated blood pressure. Although the risk of a recurrent stroke is a concern for all survivors, flying increases this risk and should be considered carefully, especially in the first 6 months to a year after a stroke. Overall, it's up to your doctor to decide if and when it is safe for you to fly after a stroke. Everyone has different risk factors and medical complications that may require a greater waiting period before flying. When you receive medical clearance, make sure you are prepared for travel and are aware of airline and destination guidelines regarding your health status and medications. Take precautions like wearing compression stockings, moving frequently, and allowing for additional time to reach your gate. These give you peace of mind so you can enjoy your trip. We hope this video has helped educate you on the risks of flying after a stroke, the importance of consulting your medical team, and different tips to help keep you safe during travel. Your health is the most important factor, so exercise good judgment and enjoy your travels. Thank you for watching. Don't forget to subscribe, like, comment and share.